Thank you, and welcome back to the Dawn Show. We are now joined by Allison Bischoff, a brain tumor survivor and Race for Hope top fundraiser. So Allison, it's good to have you here this morning.
Thanks, glad to be here.
Yeah, and now, did you know Dr. David Andrews from Jefferson before today?
I just met him today.
Okay, so you'll see each other at the walk.
Oh, for sure, yes.
Right.
It's a small world, and actually we found out the next group of folks, you grew up on a street, or you were on a street where they were.
Yeah, I lived across the street from your next guest, so it's pretty
From the
amazing. It's a
Laccas.
small world, this brain tumor community.
Well, and that's what I'll ask Dr. Andrews in a second about environmental, impacts with brain tumors. But give us your story. When were you diagnosed, Allison?
I was diagnosed 4 years ago. I have a grade 3 anaplastic astrocytoma, and I was a nurse anesthetist, so working, having children, doing the thing, and suddenly my left hand wasn't working very well. My handwriting was strange, my coordination was off just with my hand, and I'm left-handed. So I noticed it right away, and at work with anesthesia, you really need your hands, of course. So eventually got an MRI and found out I had a big, fat, juicy brain tumor on the right side of my head. So I had surgery and radiation and chemotherapy, and I'm doing well 4 years later.
And here you are. You're just so, flip about it. Oh, yeah, a little brain tumor, a little action. And now you're a major fundraiser and coordinator for the event.
The Race for Hope in Philadelphia, sponsored by the National Brain Tumor Center Society, and we're raising money for research. It's all about finding research money to find the cure. There is no cure for brain tumors.
Yeah, no cure right now, but a lot of great treatments that we've been talking about. So here it is. It's Sunday, November 3rd. It's the Race for Hope, and it's the great location, the Philadelphia Museum of Art and the steps, where Rocky ran, right? It's the famous Rocky Run, but it is a great location.
It's a beautiful day. It's very inspiring. It's emotional, but uplifting, and remember those who have passed, and we celebrate those of us who are still here. Doing our thing, going about society, trying to find a cure, raising our families, and just working hard to get by every day. There's a lot of challenges to being a brain tumor survivor, but the Race for Hope gives us this hope.
So what challenges? I mean, you seem great. You seem perfectly healthy.
Thank you. I lost the use of my hand. Every survivor has a different story. My hand doesn't really work. I do have some executive functioning changes in my brain in terms of anxiety or not being able to organize myself, things like that. And a lot of brain tumor survivors have those issues. But everybody has a different story to tell.
Yeah, absolutely. So, Dr. Andrews, when you hear about this, and we were talking in the green room, as a matter of fact, about, the Phyllis with the, the vet and Darren Dalton and so on, but you hear about neighbors living on the same cul-de-sac.
Right.
Is this environmental? You can't help but think that.
Yeah, it's very tempting. There is no basis for an environmental impact. In fact, one thing that we're consistently doing is demystifying cell phones. And it's really, there's absolutely no evidence that cell phones have any impact on any sort of tumor growth whatsoever. So that, for all you cell phone addicts, it has no impact.
Well, luckily my kids are in school because I'm always telling them, radiation, this will give you cancer, no video games, don't play with my phone, but I'm just saying that, but it is something that you think about.
Right. So nothing going for that. And having said that, there was quite a stir because there was a Scandinavian huge epidemiologic study that sort of said that it was like a grade 3 risk for cancer, which is so nebulous it's hardly worth mentioning. Just because there's an uptick in one study that's teeny, whereas all these other studies show no evidence of impact at all.
Other than, for example, Allison saying you noticed in your left hand and you're left-handed, what are some of the signs? Because it seems like people are young or of all different ages, perfectly healthy. How do you know? What do you look for?
Well, the cardinal feature is often headache. Usually headaches that are worse in the morning, global in nature, better during the course of the day. We all get headaches, but this is a sort of headache, and I don't know, Allison, if you got a...
Did you have
No
headaches?
headaches, no seizures.
So the other but typical thing is that it's in a location, such a tumor, near what we call eloquent cortex. So we as surgeons can take out 200 grams of a right frontal lobe with no impact at all. But if we take a gram or a half a gram of the motor strip, somebody's completely disabled. So when tumors are near eloquent brain, speech, motor function, sensory function, vision, then symptoms are much more obvious and sooner than when they're in the frontal lobe.
Okay. So, I mean, that's scary that you think of being perfectly healthy and we don't know what causes these. And are there personality types? I mean, I've had doctors tell me that if you're type A or you're high stress, that stress can kill you. I mean, is some of this, you know, for you as a survivor in particular, do you tell your survivors, maybe because you're a world-renowned surgeon and world-renowned expert in neurology, but in essence, if Allison continues to lead a high-stress life, that's not a good thing for the recovery process.
Right, right. So change in personality or just change in executive function are really palpable for you as a patient. Mm-hmm. We're trying to understand from a broader perspective why that is. And we think one interesting phenomenon, it's all such, we were talking about this earlier, information is just coming forth so quickly. But our brains have what are called a default mode where there are whole connections to the brain that are working 24/7. And it's called the default mode network. And we're just now trying to see how disease like Allison's, that default mode network is being perturbed. And then of course we have to understand how it's also perturbed further by our interventions. And that may help us understand where these disabilities are really arising from.
Mm-hmm. So I'm always talking about, you know, whole food diet and eating healthier. I mean, is this something that you talk to patients about? What foods to eat, what foods not to eat? I mean, some cancer survivors, they'll stop eating red meat or, you know, this
Sure.
sort of thing. So, you know, is there a specific food that's better for your brain?
There isn't. I think it's more, it's a broader campaign that we should all abide by, which is eat sensibly. I know that we often get patients that are interested in some alternative treatment. Mm-hmm. And my rule is a rule of three. One, that it's not dangerous. Two, it's not expensive. And three, you don't have to go to China to get it. And if it fulfills those criteria, then no problem.
Mm-hmm. Pretty laid back.
Yeah.
So what are you doing to keep healthy and just continue on with your life, Allison?
Well, I know that my tumor has not come back, and I'm lucky for that. And I think part of it is trying to minimize the stress in my life, trying to eat right and exercise. I think you just live your life just like you do, just like everyone does. And, you know, you do your treatments and you get your MRI scans, and you just hope for the best. There really is no magic button or thing to do, I guess.
Which in society we all want that.
Yeah,
you know,
we do.
Eat walnuts and
Yes,
you know, swim every day.
Yeah.
Yeah, blueberries
Yeah.
and tomatoes, right?
Right.
We all want those fast, you know, push button and it's all cured
Yeah.
and it's all better.
Right.
So for the walk, what is your favorite part of this Race for Hope event, November 3rd?
I think seeing all the families there celebrating either their loved one who's with them or the loved one who has passed, and just seeing them all get together. It's like a big reunion. There's 7,000 people. Certainly a bunch of them are there just to run the 5K, which is great. And then we have hundreds of teams, and everybody, the outpouring of love and support is just amazing.
Oh, well, Allison and Dr. David Andrews with Jefferson, thank you so much. And when we come back, more love from the Lacca family and a very special lady named Mary. Be right back.